So this is a way of me trying to like figure out if a person has what the tendencies of having a disease condition but it's not showing, then the person can be able to spread it to their children. Do you understand? So somebody that has a disease condition and the disease condition is not showing on them, all right, it's called a carrier. So if somebody is a carrier, all right, and the person marries another carrier, the two of them can now contribute toward giving birth to a baby that is showing that disease condition. Them is not showing, they are only carriers. But the father gave one, the mother gave one, they join together, they form a full baby that has the disease. So there's a way that you can screen people to know that if they basically have any disease condition that is hiding in them but it's not showing up. Do you understand? So this can help you to even advise people if they should marry or not. Do you understand? Because if a guy is a carrier, a girl is a carrier, they might end up giving birth to children and their whole marriage can be scattered because they'll just be moving from one hospital to another. You understand? So these are just basis of you trying to know this so that I can advise people as a healthcare provider. So genetic carrier screening is just a type of testing. It helps to identify whether somebody carries what a gene, okay, that could be passed to their children. All right, potentially if they pass it to their children, they'll cause a problem. So even if the individual is not showing it, do you understand? Because most of the times the individuals are not showing it. All right, it's just few disease conditions, and in fact, if you're a carrier, you don't show it. Do you understand? If the disease is showing on you, yes, you have the disease, but you are not a carrier per se. This one you are affected. You understand? A carrier is more of like you have a disease, but it's buried underneath. It's not really shown. So what is it? So the blood, saliva, and cheek swab can help you. All right, so they do some 1 or 2 tests in the laboratories, okay, and can help you dictate if somebody is a carrier of any genetic mutation. So most commonly used to dictate what autosomal recessive and X-linked conditions can be done before conception, during pregnancy, just to inform reproductive decisions. Do you understand? Because this can help you, advise couples and all of that, So why it matters? If both parents are carriers, bro, all right, there's a 25% chance that you'll give birth to a baby that is affected. So please pause and observe this place. All right. All right. So for X-linked conditions, even if somebody is a carrier, we say X-linked, men are what? XY. Okay, women are XX. So let me just tell you guys an exception. If a woman has an X-linked condition, it destroys one X, but one X still survives. If a man has an X-linked condition, it destroys one X, there's no X left, so the man is affected even though the person is a carrier. Do you understand? He's a carrier and he's also affected. So it helps families prepare emotionally, medically, and financially. If you guys are stubborn enough to still go into that marriage, then you should be prepared for what all the financial constraints that might come up with giving birth to children that have a lot of issues. So commonly conditions that they can screen for is things like cystic fibrosis, sickle cell disease, which should be the most popular, Tay-Sachs disease, fragile X syndrome, spinal muscular atrophy, a lot of them. All right. So when to get screened before pregnancy, this one will help you to know if you still want to be stubborn and go into the pregnancy. During pregnancy, this one will now help you to prepare for the outcomes. So that's just what the genetic screening for carrier simply entails.